It's Monday, July 6, 2021. I'm Jonathan Lau, and this is 5 Minutes of Proof, a weekly analysis of the science behind ozone therapy. Today, we're going to be looking at an article that comes to us from Japan. It was accepted in February of 2000, and the title of this paper is Intramammary Application of Ozone Therapy to Acute Clinical Mastitis in Dairy Cows. This is a really cool paper because it's one of the few that talks about treating mastitis with ozone. So let's start with the abstract here. 60%, 9 out of 15 of cows with acute clinical mastitis treated with ozone therapy did not require any antibiotics for recovery. This newly developed ozone therapy method was proven to be effective, safe, and cost-effective and carries no risk of drug residues in milk. Now, one of the real issues with treating cows with antibiotics is mentioned here. It's really about the loss of milk due to drug residues and what results in a poor cost-benefit ratio for most antibiotic therapies, as it mentions. So that's an issue for dairy farmers and organizations, companies that produce milk. So they use ozone gas, actually. If you look at this picture, you can see that they attached the cannula to a silicone tube, which was attached to the ozone generator. And that's how they did this treatment. Now, they say the total amount of infused ozone into each inflamed quarter was estimated at 6 to 30 milligrams, which was equivalent to ozone concentration of 6 milligrams per liter or 6 micrograms per milliliter, determined by the ozone detector when 1 to 5 liters of ozone gas were infused into a quarter. The rate of oxygen flow was 1 liter per minute. So this is a lot, like it says, 1 to 5 liters of ozone gas that was infused into each quarter, depending on how much that quarter could hold. So they did a number of tests to show how ozone affected these infections as compared to antibiotics. So the SCC count was one of those things, the temperature of the cow itself, and a number of other things. They say no significant difference in changes of clinical sign was found between the ozone therapy and antibiotic therapy groups. So that's good in that ozone therapy was shown to be as effective as antibiotic therapy. And in particular, we'll notice in a minute that it was as effective or more effective actually in treating some types but not in others. So this is interesting. You see these different pictures here, and I'm going to read a portion of this about that in a second. They say after ozone therapy application to the inflamed quarter, acute clinical mastitis showing systemic and local symptoms was greatly improved. The rectal temperature decreased to a normal range. That was an improvement in appetite, and the general conditions of the inflamed quarters were improved, though an increase in clots were found in the quarters during the first few days after ozone therapy. So that's what you see here. So for some reason, it caused that quarter to excrete clots at first. It was evident that there was very little difference in the effectiveness and convalescence of both antibiotic therapy and ozone therapy. However, ozone therapy appears to have a great advantage over antibiotic therapy because dairy farmers are required to discard all the milk treated with antibiotics. No milk withdrawal time is required with ozone therapy. In addition, there is no risk of drug residue in the milk. Ozone therapy would be a very useful method as a first selection for the treatment of acute bovine clinical mastitis. Okay. And then down below it says, some cases of clinical mastitis, however, were found not to be efficiently cured by ozone therapy as a first choice. Therefore, antibiotic therapy was applied to these cows. So certain pathogens didn't respond as well as others to ozone therapy. And that's of note here. Finally, about 60% of cows with acute clinical mastitis recovered by ozone therapy alone. So it's a great way to treat clinical mastitis as a first choice, especially, I think, for those farmers who are looking to get away from antibiotics. This has been 5 Minutes of Proof. We will look forward to seeing you next week.